Нормально? If it is the section of the vessel, then all three threads must be in the same length from each other. Long three threads. After stitching these three threads and tying the knot, the assistant, 1, 2, 3, assistant must turn in each of the sides. What happened with the round vessel?
To give like a triangle.
Yes, it will be triangle in shape. Yes? And if it is triangle in shape, it's very easy to stitch when the side is straight. And the one side, the surgeon stitch it after the assistant change it. The here and after that here. And when we will finish, these long threads must be cut and the vessel will be stitched. Will it be the triangular? No. After operation, it will be same the circle.
So please tell me, so after the decision, what happened? I didn't get the last decision. I didn't get the last part of your...
Last part?
Say after the...
After that, we cut this hand holding threads. Because by these threads, by these three threads, we hold the vessel. We cut these long threads and then stitch back the all soft tissue. Ligation of the vessel. What is it?
Ligation.
You can use, yes, it is there. No, ligation of the vessel, it is
Open.
no, it is for the stop bleeding. Yes, it is method for the stop bleeding. Is it temporary? No.
Permanent.
It's permanent, because if you ligate vessel, you will never can to remove it. Yes. For ligation, you can use the ligation needle. The needle for the ligation. Look please, it has eye for the thread and under the vessel. You will, without the removal of the vessel, you must just under the vessel make it the thread. And after that, just ligate it. That's it.
So
do we need to perform this sutures?
No,
Just
just
explain.
explain. Yes. For the tendon of the suture of the tendon, there are two types, cuneo and lange. What is the difference between these two? Also, you on the desk, you will draw the scheme of this suture. For cuneo, maybe it is difficult, but it is easy. Distal and proximal, we start from the long thread, where on the both sides, 2 needles, straight needle. After that, by these two, one by one, we make like the 8. And it's very important that the end of the thread must be on the surface of the tendon. They're absolutely same for this. Yes, it is tendon. And we must tie both of them together, and the knots will be where? Inside the tendon. It is very important for us because the knot, if it will be outside, for the movement, the early movement, it will be damage the sheath of the tendon. That is why if the knots will be inside, it is good. But if they are outside, it is bad. As a variant of the outside, the knot is outside, is lange suture. It's like double U shape. What is it? Understand? Here is like you. Continue for the distal part is like you. And near the beginning, the end is near to it. When we will tie it, join together, but the knot will be outside. This one is good, then this one. Understand? Yes. This is the skin. Okay. Whitlow, what is it? Inflammation of the tissues of the fingers. Yes. Panaritsu, Latin name, or Whitlow. There are 5 or 6 variants. Maybe the skin, under the skin, the tendon, the bone, the joints, the inflammation for the different tissues. They are known as the different type of the Whitlow. For example, the tendon Whitlow, or for example, the bone Whitlow. Yes, and if the all tissues inflamed together, this is the pandactylite. Dactos is the Greek name, pandactylite. All issues of the bone, the tendon, the all together. What is the treatment for pandactylite?
To remove the amputation.
Not amputation.
The
Disarticulation.
Disarticulation.
It's usually for fingers. They certainly use the disarticulation. What is the disarticulation? Да. Сейчас иду, сейчас заканчиваю консультацию. На понедельник консультация.
He has done puncture of the joints. He has not done.
He has not done puncture of subclavian.
Is it in this practical? Are you sure?
He has done puncture of joints now. What's in the top?
Subclavian vein. It's not practical.
Subclavian axillary this one.
It is for
He has
Whitlow.
He has done this one.
The Whitlow, which is not damage the whole tissues. For example, just the skin or maybe
It's
the
not
tendon.
puncture.
We use the
It's
bilateral,
technique for
yes, middle and lateral cutting, but never above the joint. Just on the phalanx.